Hola amigos de ASO Digital Content. Estamos aquí en una entrega para hablarles de algo tan simple y tan sencillo como lo que es el hecho científico. El hecho científico que en muchas ocasiones pues se nos olvida que la importancia es simple y llanamente conocer, aprender, buscar la información, conocer todo aquello que nos pueda resultar más importante para obtener esa información que nos da el siguiente avance para la investigación. Últimamente podemos conocer y hemos conocido que, bueno, pues a lo largo de los últimos tiempos no siempre estamos demostrando que le tengamos respeto al hecho del conocimiento. Incluso en las aulas, cuando conocemos a las personas que imparten clase de ciencias, pues imparten clases como vademecum y no tanto como hacer que los alumnos amen la ciencia. Y eso es muy importante porque si uno no está enamorado de la ciencia, es decir, de la investigación, del conocer cada factor que puede y cómo puede afectar y alterar los hechos físicos que nos encontramos, nos podemos dar de bruces con una pared y es el oscurantismo, que es de alguna forma lo que el doctor Campbell a lo largo de los últimos años, desde el año 19-20, lleva trabajando de una forma como lo hacen los ingleses, con ese punto de ironía, con ese punto de inteligencia mordaz que nos hace a veces sonreír y a veces, si estás en la diana, nos duele. Y en esta ocasión el doctor Campbell les tendré que decir que hay cientos de vídeos interesantes del Dr. Campbell, con lo cual ustedes pueden perfectamente acceder a su canal de YouTube y ahí no lo piensen, vean y escuchen. Es inglés, pueden traducirlo, pueden poner subtítulos y si tienen la suerte de entender el inglés, pues escúchenlo porque su inglés es fácil, sencillo, estándar y bien hablado. En esta ocasión, el doctor Campbell ha utilizado una ironía sin decir absolutamente nada, pero para los que le seguimos y conocemos también lo que es el hecho científico, dice mucho. Dice mucho porque hace con una fórmula que es colocar un espejo para que nos veamos reflejados en él. Y habla de algo tan bonito, tan bonito, tan bonito como cuando aquella primera vez en las clases de biología nos explicaban cómo habían podido llegar a determinar la mortalidad en los primeros partos, en el nacimiento, cuando simplemente separaron los nacimientos a un piso distinto a donde estaban el resto de enfermos en el hospital. Corría el siglo XIX, gran siglo de descubrimientos y de apasionamiento por el conocimiento científico. Triste que en ese siglo XIX se intentó colocar enfrentado el conocimiento a la creencia, a la religión, al seguimiento, a la fe, a Dios. Pero ese es otro tema. Los que estamos apasionados por el conocimiento y eso no nos desdice para que sigamos siendo católicos, creyentes, apostólicos y viviendo nuestra fe día a día. El señor Campbell, el doctor Campbell, nos trae un hecho científico de interés, que yo no les voy a adelantar porque si no entonces mataré la historia. Pero es un hecho relevante donde muestra el señor Campbell, el doctor Campbell, que la ciencia lo único que tiene como poder es la persecución de la verdad, del conocimiento y de cómo si conseguimos hacer una buena investigación en hechos, seguro que conseguimos alcanzar esa verdad que nos beneficia a todos. Hace tiempo, hace muchos años, pues una de las clases de ciencia, de filosofía de la ciencia y de epistemología de la ciencia, pues dijeron un profesor que era simpático, agradable y muy inteligente. Cuando en ciencia algo es muy complejo, lo más probable es que sea mentira. Les dejo con el doctor Campbell. Les he hecho una traducción para los que pues no tengan ganas ni de leer la traducción online, ni tampoco les sea cómodo escuchar en inglés. Perdonarán mis expresiones, pero no es una traducción al uso, sino más bien una interpretación. Así que les dejo con el doctor Campbell, pero sobre todo quédense con la historia y con los soulignés, con los subrayados que hace el doctor Campbell, porque son de gran inteligencia e ironía. Hasta la siguiente, chao, aquí en el canal de ASO Digital Content. Chao.
Well, a warm welcome to this talk. Now, I was down in London a couple of months ago, and I took the opportunity to go to Soho, and specifically in Soho to Broadwick Street. And those of you who are students of epidemiology will immediately realise that used to be called Broad Street, and it was the site of the cholera pump identified by Dr John Snow. Let's have a look at some video I took there, and then we'll look at some implications for the present day as well, because we need to learn from history. We stand on the shoulders of giants. Well, here we have it, John Snow's famous cholera pump. It was on Broad Street, it's now on Broadwick Street. This pump, of course, is a replica. I think it was put up in 2018 by the John Snow Appreciation Society. And they've also put the name of a pub after Dr John Snow. Unfortunately, it was closed when I was there, so I couldn't check it out from the inside. But this is a replica of the pump, and it's in exactly the same position as the original pump. And of course, I was relieved to see that the handle has still not been replaced. We don't want contaminated cholera water being pumped out the ground. Although I think the cesspit's probably dried up a little bit by now. Now, in 1854, this was the Broad Street cholera outbreak. John Snow said this: "The most terrible outbreak of cholera which ever occurred in this kingdom." And on the 31st of August, and in the 3 days after the 31st of August, there was 127 deaths in the immediate area. The death toll eventually rising to 616. And interestingly, the people that were sick from this, a lot of them went to the Middlesex Hospital. And at the time, Florence Nightingale was in charge of nursing there, and she nursed many of these patients personally. And some, due to her care, did recover, although some did sadly go on to die of shock and dehydration. Now, John Snow contacted the councillors of St James's Parish, and they agreed to take the handle off the pump so that people could no longer pump the contaminated water. And after this, the cholera epidemic started to subside. It had been going down already anyway because people were leaving the area, but it's based on this map that he produced. He produced this afterwards, and it's the first real map of epidemiology showing spatial correlations. Let's have a look at that now. So here is John Snow's 1854 cholera map. And as we go in, we see Broad Street here. This is Broad Street, and we can see the position of the pump just outside the pub. And these black bars you see here represent coffins or deaths, and we see that they cluster around about the cholera pump. So we noticed that there was a spatial correlation from people getting their water from this pump that was next to a cesspit that was draining sewage into the collection area for the pump. And he also noted, of course, that there was a brewery just down the street. And the brewery workers weren't drinking the water because the brewery workers drank mostly what's called small beer. This is beer with about 0.5% or maybe 1% alcohol content. But the key thing is the water was boiled in the preparation of the beer, so they didn't get it. This is the famous map generated by John Snow in 1854. And for this is rightly called the founding father of epidemiology. Well, of course, there's a lot more detail we could add to this. For example, he looked at the Seething Wells water supply, which was taken from water upriver, up from the River Thames, nearer its source, and he compared that to the water supply taken lower down in the city from Southwark and Vauxhall, which was more contaminated. and he noticed that the Southwark and Vauxhall supplied households had 14 times the rate of cholera mortality compared to the Seething Wells households. So just looking at basic information, doing a fairly simple analysis on it, and finding out that you're 14 times more likely to die depending on your water supply. And of course, there's so many modern things where the same thinking can be applied and occasionally is applied. Now, of course, there's so many things that we can learn from this that apply to the present day. And the first thing I want to consider is why did John Snow succeed when others failed? He wanted to keep his patients alive and well. He was passionate about his work. He was passionate about human life. I think that was a big reason why he succeeded. He was distraught by the suffering and death he worked amongst. Now, if you read his writings, you can see that the guy was really suffering with his patients. He was in the area. He knew the smells. He could hear the sound of the bereaved relatives. He knew what it was like to be in this suffering, and he fought against it with everything he had in his being. This is the level of commitment that we need in all times, especially today. He was motivated by a concern for his people. He had a good understanding of the science of his day, which of course is important. He was an advocate of germ theory as opposed to miasma theory. And it's often said that fortune favours the prepared mind. So we still need to do our homework. He realised prevention was better than cure. I mean, what a simple principle. Why don't we stop these people dying rather than treat them when they get sick? Because by the time someone had cholera, they're often very dehydrated. The stool just runs out like water, and people become dehydrated, fluid and electrolyte imbalance, hypovolemic shock and death can occur really quite quickly, especially in children. Terrible, terrible disease. And at that time, they wouldn't have the ability to rehydrate and fluid resuscitate as we have today. Although still, cholera is a remarkably dangerous disease today. Realistic lifestyle choices. Realise that lifestyle choices are critical for health. The water that you drink, where you get your water supply, is critical. Who else was involved? Now, the population of patients accepted his medical opinion. So the patients respected what their doctor told them. And the local authorities shared a concern for the population under their charge. They took seriously their duty of care. So we had a situation in St James's Parish, in Soho, in that area, in 1854, where the local government, the parish council, cared deeply for the well-being of its citizens and followed the advice of their respected medical leader. Is that always the case today, I hear you ask? Right, let's make some of my observations about this case. Widespread ignorance made disease essentially inevitable. So yes, the conditions were appalling, but the main problem arguably was ignorance. If you can keep people in ignorance, they're more controllable, aren't they? But these people were ignorant of what was causing this. Is ignorance a problem today? Let me know what you think. No money was made when he removed the pump handle. It was motivated by concern for humanity and the science. So no money was made. Would this still be the case today, or is money more important? Taking the pump off the handle cost nothing. It was free to do. It was a free intervention. No vested interest opposed his work. No one tried to actively suppress the new discovery. So here's a new idea. No one said, oh, this is a new idea. This could save lives. Better hush this up. Because really what we want to be doing is selling people, I don't know, cures or something like that. You know, if people are, if you take the pump off the handle and you stop people getting sick, could be a good wasted business opportunity potentially. So anyway, that didn't happen. I'm pleased to say there was no well-funded, well-connected, powerful vested interests opposing his work. Therefore, his work went ahead. He was heard. No international organisations opposed his work or tried to suppress his findings. That didn't happen, thankfully. Corporate and national interests did not make money from the intervention, but they supported it anyway. So the local government and the local businesses supported what he was doing anyway, despite the fact they weren't making money from it. Work was not opposed by powerful, rich individuals. So there was no millionaires coming round trying to interfere with John Snow's work. He was free to investigate. He was free to collect the data. He was free to publish the data without any obstruction. No one called what he was doing harmful misinformation. And he didn't receive death threats. Life-saving discovery was not suppressed by national regulatory bodies. In fact, the national bodies supported him. So there was no suppression of information by national regulatory bodies. National and international bodies did not claim there was insufficient data and insist on a multi-million-dollar randomised controlled trial. You really think this works, Dr. Snow? Well, come. We need a randomised double-blind controlled trial on this. It's going to cost us $20 million. We need at least 1,000 people in it. And we're going to need some professionals to organise it. You get out of the way, you bumbling amateur. It didn't happen. So he succeeded. Lives were saved. So no one insisted on silly amounts of further data. Publishers helped to distribute the new knowledge. So this was in the newspapers. It was lauded. It was published. It was spread abroad, literally abroad, throughout the UK and throughout the world. And people who'd never heard of England or London benefited from this discovery. Absolutely brilliant. No one used oppressive censorship to silence him. So he wasn't oppressed by censorship. He was allowed to speak freely. He was not deplatformed by media organisations. Wonderful. He and his ideas were not personally attacked by the legacy media. They promoted his work. The helpful intervention was not opposed by people who could make money from the sick. Relevant publications were not written by people who could make money from selling cures or vaccines. This simply didn't happen. Counter-argument was accepted and adjudicated by the evidence. Now, there is famous cases of people who debated with John Snow, who was in favour of germ theory. Other people believed the miasma theory, which is that disease is caused by bad air. That's where we get the term malaria from. But quite a few people, because of John Snow's reasoning and science and evidence, changed their mind. They changed their mind. They said, you know what, John? I used to believe in miasma theory, but because of the evidence you've given me, I now realise that germ theory is correct. I'm going to change my mind. I'm going to change my mind because you have presented me with evidence. This is what we have to be prepared to do. Follow the evidence wherever it leads. So counter-argument was accepted. There was no, this is my position and I'm sticking to it, mate. The principle of disease mapping went on to save millions of lives, and still is today, of course. Taking the pump off the handle became a common expression. So these days, for example, if you want to, when we wanted to prevent lung cancer by telling people to stop smoking, that would be taking the handle off the pump. Now, there's lots of pumps today with lots of handles. We need to take lots of handles off lots of pumps today. Let me know what pumps you think these are and what the handles might represent. I can think of lots and lots of examples, but I don't want this video to last forever. Finally, would he be able to succeed today? Let me think about that one. I've thought about that one. No, I don't think he would, for all these reasons that were mentioned. Because right now in London, I can think of half a dozen brilliant doctors and scientists whose work is not listened to. In England, in the United States, I've talked to famous doctors, scientists, statisticians, biochemists all around the world whose work is simply not listened to. There are many pumps still pumping out water contaminated by cholera. We need to identify the pumps, identify what the handle is, remove the handle, and take away, or at least massively reduce, the human pain, suffering and death caused by that contaminated water. In memory of Dr. John Snow, 1813 to 1858.